Good day, everyone. My name is Joanne Pasek, your medical tourism facilitator, and this is something I would like to share to you because I think we are all the same. We are all equal when it comes to health. This is a constant reminder. Even though I have a life medical tourism consulting, but number one that I always have to look after to myself, and that's the same with you, because even though I have a service like this to clients, but I have to look after myself. Not only I'm depending on the doctors or any health medical professional, like for instance at the age of late 30s, I knew there was something going on with my body since I've got the same knee swelling on my left side, and it's constant or consistent for 2 years. So that's why I have to make my own decision to check and being persistent and pursue that to the medical doctor, my family physician at the time, to do some tests because it's very odd. It's the same location, the same pain, and it occurs in a certain time period. Okay, to make the story short, so I was diagnosed of osteoporosis 1 point below at my age bracket. Okay, because testing for a bone density, it should be on age bracket. The system is if you are low or good. It depends on the age, and at the time I was very late 30s, going to 40 years old. Right now I'm 46. So I am 1 point below, so that's good that at least I managed to ask my family doctor to do that test, because I'm still not allowed to do it because I'm young. But of course, I know my body that there's something wrong. So that's dealt and done. So now I know I have osteoporosis, and now I maintain my diet and basically live a healthy lifestyle, diet, and so on. Now, also, I have a arthritis. That's not only hereditary from my family, but the job that I've been doing. I use a lot of my hands, working on my hands, especially working in the clinic, doing computer stuff and so on, filing, and then also I have my other job, working on the in a big market, right? So I'm mostly working with hands using the machine. So now I have that arthritis, and basically, of course, it's obviously it's visibly that my hands is not look perfectly nice, right? So that's arthritis, but still I did not pursue whether it's a rheumatoid arthritis or osteoarthritis, because that too is different. Okay, and I will follow it through to you and share it to you guys. Now, another thing also is, since I came from the Philippines, and mostly Filipinos, when they take a TB test, it's always positive. It doesn't mean that you are very sick or you're not sick, but you look healthy, you're healthy, but the result will come back positive for the skin test, TB testing. It's very normal because of the exposure, tuberculosis exposure. Mostly Filipinos will come back the result positive, so it's called a carrier. Okay, but you don't have to be worried or scared about it. It's just part of nature, right? So normally when I have let's say if I take a job, or even you will take a job, apply for a job, number one requirement is that they be testing. So there's a test for TB skin test, and then if it's positive, the result is positive, came back, so you don't have to worry about it because it's normal if you are coming from a country that's very exposed to tuberculosis. And then you just have to simply monitor your x-ray. It's a physical examination, and part of the physical examination, that's the x-ray, right, for your lungs, right? So now that's also, I've taken care of that because I'm very, very on top in everything what I do when it comes to my health. Now in here also a few years ago, I think, as I said, it was late 30s. I was going about 40 at the time when I found my pap smear. Okay, the Papa Nicolau examination. This is for women. Okay, so there is a abnormal cells. So now the doctor has to check on it, to look into it by the telescope. It's a small endoscopy inside to the uterus and check, so they found a little bit of those polyps. So they took out the polyps using the laser, very minor procedure. So that's been taken care of, and then I accepted to go on for a research program on this particular scenario, or in my case, that for a year I decided to be part of the research program, and then I'm off already now. I'm not already part of the program since everything is normal, right? But of course, as right now I'm 46, so the test, the physical examination for pap smear for women, it's actually mandatory, and right now it's like every 2 years, right, or every 2 years. And if there's abnormalities, then the family physician will ask to you, or the specialist or the cancer clinic will give you information if you need to be seen yearly. Now, another thing also is, this is also part of the scan when they found the polyps. The polyp has been removed already. Very, very easy procedure. And this one is the echocardiogram. I'm still very young at the time. As I said, it was I think early 40s when I found like spasm right in the left side, and I said, okay, I have to make sure that this is not something else. So basically it was just a muscle spasm on the left side. It's not as something scary like a heart issue. But take note, in my family, in my father's side, the heart disease is prevalent. Okay, so I have to make sure that I know my history, my family history, that this is this and this is that. Then that is preventable if you wanted to live a lifestyle that actually that you know that you can prevent these diseases, especially right now for the medical technology advancement. So basically this is the result for the echocardiogram, and that was it. I was very persistent to do this test, and you have to listen to your body, because even though I did listen to my body, but you have to be honest and have a conversation with your family physician. And then if your family physician is still very slow in action, just let's say, then you can go for another doctor, another physician, for a second opinion. And it's very normal, and you have the right to do that because it's your body. And it's the same thing with the medical tourism consulting or the life medical tourism. You can make your own decision, but be discerning to where you're gonna do the procedure. So this is just personal information about my health, and so that something can relate to you guys, because we are all the same. I cannot escape in this kind of diseases, but due to the medical advancement nowadays, you can do things like the word preventive medication or preventive medicine. So I hope this is helpful for you guys.